When we experience a trauma, whether it's a small one or a big one, whether it's emotional or physical, usually we don't have the capacity to do anything with that trauma. And so our body has to put that energy someplace. And usually that means that we store it someplace in our body. Now, that can be where the body was actually traumatized physically in that moment. Say you're in a car accident and you have whiplash, it could get stored in the neck. It could also be stored someplace where you're vulnerable, like maybe you were sick and you had a cough, it could get stored in the lungs. Or maybe you had something old like a knee injury that ached every now and then, but then that energy gets stored in the body. So there are any number of combinations of how this can happen and where it can get stored. It's individualized and it really depends on the trauma and your personal history. So how do we even know that's happened and what do we do about it? So usually the first easiest way to determine that's happened in your body, that you've stored this trauma in your body, is that traditional medicine can't really fix the problem, or you've been treating the problem locally. Say, again, you're having neck problems and you're treating the neck and it's not getting any better. Or you're having digestion problems and you've seen the GI specialist and the primary care and they've done all the tests and maybe they've given you medicine, but they can't really figure out what the problem is. That's when it's a perfect time to explore somatic work. And somatic work is really just a fancy way of saying that we're trying to treat something that's happened emotionally by accessing the physical body. What that means for me personally in my therapy practice is I use my hands. So I listen with my hands. I put my hands on the person's body and I'm listening to see where the body is pulling me. So I can physically feel a pull, a drawing in. It's a line of tension that the body is taking me to. And what I do is engage in that tissue, in that system, and listen and follow and give the body some space and the tissue some space to release. It's a very simplified way of doing it, but that's really what I do all day. So a lot of times people say, okay, that's great. What does that mean as far as my personal experience as the person laying on the table in the treatment room? It could mean a lot of things. And I think that there's recently been some viral videos about some emotional releasing that's happened from some famous people. And that is certainly a very true and genuine experience where people have a very immediate and sudden emotional sensation and emotional release. Maybe that's crying, maybe it's laughing, maybe it's just a big surge of anger. It's a very real thing. And I've seen it. It doesn't always have to happen that way, though. When you're receiving somatic work, success doesn't always mean something dramatic. A lot of times it can be subtle. Sometimes I can't tell you how many times people have told me that they thought they were doing pretty good. They walked to their car, or maybe even later that day, and all of a sudden they started crying and they didn't know why. So really what it's doing is it's disrupting the tissue that is holding on to that emotion. Sometimes people can relate what that old emotion is. Like maybe they remember something that happened to them emotionally, but a lot of times it's not. Sometimes it's just an emotion and we can describe the emotion, but we can't contribute it to anything specific. And all of those are very real and legitimate and genuine ways to experience an emotional release. Sometimes an emotional release isn't emotional at all. Sometimes it's just purely somatic, meaning the tissue releases and with it, the emotion that comes with it. And then that is resolved. It doesn't have to be some big feeling. It can just be discharged in the tissue or also in the brain. Another way we treat that is by working on the head, making sure that we're treating the brain and the fluid around the brain and making sure that's balanced. We also treat the nervous system. The nervous system is the regulatory system. We are bombarded all day, every day with stressors, and that can ramp up our nervous system. That's what stress is, right? So we feel stressed and we can feel it in our physical body. Our nervous system is ramped up. What the techniques I do are helpful for is to suppress that nervous system. So we're desensitizing the sympathetic nervous system, which is the fight or flight response. So we're turning that down, and then we're helping to turn up the parasympathetic nervous system. That's the rest and digest system. So if you're having digestion problems and we can't figure out exactly what's going on with it, it might be that imbalance. Maybe that parasympathetic nervous system is just not kicking in the way it's supposed to because it's being overridden by the sympathetic nervous system. Stress, right? We can all relate to how stress relates to our gut, how we get an upset stomach or butterflies when we're nervous. Like all of those things are real life descriptions of the way our sympathetic and our parasympathetic nervous system affects our lives.